Hello everyone, I am Dr. Pushpa Saravanan and I am Associate Professor of Diabetology at Madras Medical College, Chennai, and I also have my own private practice in North Chennai.
How does Imeglimin fit into your regular practice with the current landscape of T2DM treatment options? Kindly share your experience.
So, Imeglimin, it's comparatively a new molecule which has come into the market, and we have been using it for almost a year now. And it is a novel therapy for type 2 diabetes, and its basic function is it targets the functioning of the mitochondria. So we have a lot of mitochondrial dysfunction in diabetes. So most of the other drugs, they don't address this problem. So this mitochondrial dysfunction, which is addressed by Imeglimin, it improves the insulin secretion and insulin sensitivity. That is, it reduces the insulin resistance, which is the major mechanism of type 2 diabetes other than the relative insulin deficiency. So it reduces the hepatogluconeogenesis, and it also preserves the pancreatic beta cell, and thus because of the novel mechanism of action, it is a new way to address the problem of diabetes and uncontrolled hyperglycemia in our patients.
In what specific patient population do you see the greatest benefits of using Imeglimin?
Yeah, so this is important because most of the patients we see in our government hospital or those who come to me, so usually they will be already taking treatment somewhere or the other, and when the blood sugars really go haywire, they are not able to control it, and many the number of times patients are not willing for starting insulin, or if they are on insulin, even with insulin they are not happy. So such patients mostly are referred to us, the ones you call the difficult diabetes patients. So these patients, when they come to us, one drug which is working in a different way, it is help in such patients, and especially patients who are on metformin and they are intolerant to metformin. Now, metformin is a very good drug for diabetes, but in certain patients, it causes a lot of gastrointestinal side effects like abdominal pain, loose stools. So in such patients where metformin intolerance is there, we use Imeglimin, and it can also be added to metformin in patients who are tolerant to the drug. And it can be added with any therapy, and it helps us a lot by reducing the blood sugar, and the insulin secretion effect is only glucose dependent, which means if there is no glucose, there is no excess glucose, the drug will not cause secretion of insulin from the pancreas. So this is one important effect of the drug.
How does Imeglimin compare to other hypoglycemic agents in terms of safety and efficacy? You can share any real world case.
Yeah, so when you talk of safety, so we see that the drug doesn't have a lot of side effects. So I have not one or two, quite a number of patients who came with metformin intolerance. Not in the government setup because we don't have this drug in the government side yet, but in my private practice, surely patients who are intolerant to metformin, and many a number of times they are not even diagnosed with that intolerance. They come with a long duration of loose stools and discomfort, abdominal discomfort and dyspepsia kind of complaints. And only when we start taking a history properly, we diagnose that it may be because of metformin. So sometimes they would have undergone OGD scopy, endoscopy also, and would have been found with some kind of gastritis, which wouldn't have been attributed to metformin at that time, because many a number of times the patient, they don't reveal what medications they're taking to the consultant they go. So they only go with the complaint and they don't tell that they are taking certain medications. So when we stop the metformin, these symptoms are totally relieved. But the problem is, once you stop metformin, you are stopping a very important drug which is going to treat the insulin resistance, because it will reduce the hepatic glucose output from the liver. So once earlier when we will stop metformin, either we will increase the dose of sulfonylureas or we will add an insulin, because these patients will already be on other medications. Sometimes we'll add drugs like pioglitazone, but again, patients who are at a higher risk of heart failure or already having heart failure or severe anemia, in these patients we cannot use this drug called pioglitazone. So now with Imeglimin, which is again a very important drug which will reduce insulin resistance, that is, this drug also causes reduction in hepatic glucose output. So because of that, now we have an option to add this drug in patients who are not who are not tolerant to metformin. So that is the safety part, because they won't develop GI side effects. So that is safety. And second is the efficacy. Efficacy, it is as good as metformin, and in my patients I have seen that it works quite well. So at least in patients, Indian patients, this drug works quite well, efficacious to the tune of metformin, and it can be added with any drug. But just like any other medication, when added to other drugs, we have to always think of risk of hypoglycemia, because we are going to get a better control once we start this medication.
In recent time, Imeglimin sustained release formulation with Indian study has been launched in India. What is your opinion on that?
So yes, when a drug comes as a sustained release form, one is its effect will be there for a longer period of time, right? Because it is sustained, so slow release will be taking place, so the effect of the drug will be longer lasting. And we give this drug in a dosage of 1000 milligram twice a day or 500 milligram twice a day. So when it was immediate release form, the effect of the drug will be very fast and the sustainability will not be there. Now with the sustained release form, the effect will be there 24/7, and if the patient is taking the medicine regularly, of course. And second is sustained release formulations. Even with Imeglimin, it may cause some GI problems in a lesser number of patients, not as much as in metformin patients. But even then, there is always, any drug which you take, there is always a risk of nausea, vomiting, diarrhea. So again, because of the sustained release formulation, this adverse effect will also be lesser. This is what we expect.
How does the mitochondrial targeting mechanism of Imeglimin influence its clinical use?
So this I was already telling. See, mitochondria, we all know, we have read from the school time, it's a powerhouse of the cell. That means it provides energy. So it is a cellular energy production is taking place in the mitochondria, right? So this will help in all the metabolic pathways. Wherever, see, anything has to be metabolized, it needs energy. So that energy is provided by the mitochondrial function. So it helps in all the metabolism, metabolic regulation. So in diabetes, as I told earlier itself a little while back, there is mitochondrial dysfunction. So once there is a dysfunction, it will affect all the metabolism. So carbohydrate, fat and protein metabolism, everything will be affected. And because of that, there will be insulin resistance, and the glucose metabolism itself will be going a little off. It will become impaired. Now this drug, it targets the mitochondrial function, so which is a very important aspect of the causation of disease, right? So one of the reasons why diabetes is there is because there is mitochondrial dysfunction. There is endothelial dysfunction, there is mitochondrial dysfunction. So all these things, they cause the diabetes. So why does diabetes happen? So this is one reason. So this will, once we are able to address the mitochondrial dysfunction, you will be able to restore the metabolic processes which have gone haywire. So this unique way the drug is acting, right? It increases the insulin secretion, reduces the insulin resistance, thereby it will reduce the blood glucose. So it is a very nice and potential drug for long-term use, and I think this drug has a long way. It will stay for a long time. So it will be very helpful in our practice, and we are seeing its effects.
What are the key safety and efficacy findings from clinical evidences on Imeglimin that clinicians should be aware of?
So see, like I told, so again this GI side effects can be there, though it will be far lesser than what we see with metformin, but it can always be there. So GI side effects we will come across, but this will be lesser. And as other side effects, I have not come across, but any drug, anything under the sun, including the sun, can cause allergy. So a patient may come with some allergic reaction to the drug, so that whenever we are introducing any new drug and the patient comes with any allergic symptoms, we should stop that drug. And overall, the tolerability of this drug is quite good. So that is all I would have to talk. I would say about the safety efficacy part.
Do you believe that Imeglimin has the potential to change the future landscape of diabetes treatment?
Yeah, of course, it is already changing, right? So when you look at the existing therapies for diabetes, for a very long time, we have sulfonylureas, insulin is always there. Then we have the DPP-4 inhibitors, SGLT2 inhibitors, thiazolidinediones. Then we have alpha-glucosidase inhibitors. So along with all these drugs, now once we have a drug, so all these drugs, they have different mechanisms. So now we have one more drug which has an entirely different mechanism, but it is helpful in so many ways, right? So it will certainly change the future landscape by like any one addition is always good. So same way, it will, as more and more research is done with this molecule, we will see its importance in all the metabolic pathways and even the pleiotropic effects. So slowly, as research is done, we will also come across the pleiotropic effects. We'll see if it is helpful in reducing the proteinuria, if it is helpful in improving the EGFR and cardiac benefits. So all these will come only when large studies are done with this drug. So time is there. Time will always help us see all these things, and well, because it is a very safe and well tolerated drug, right? So very efficacious. So it is certainly a very valuable molecule in the treatment of type 2 diabetes.
Any other key points you would like to share apart from these?
Like I said, the lot of large studies should be done with this molecule in the tune of what was like for the CV safety, the renal safety. So these studies should be done with this drug also, and this drug should also come with all these effects. I mean, it should also show, and it will then only the impact will be more. So newer molecules, most of the newer molecules, they are showing not only that they are non-inferior, now they are showing that they are superior in any problems, right? Like the SGLT2 inhibitors, if we talk of, so they have shown superiority to placebos, right? So they don't cause cardiovascular events. On the contrary, they are helping to reduce the CV events. They are not causing any kind of kidney damage, but they are actually helping in improving the kidney function. So if we do studies related to that, you never know. You may come across better things. So until and unless it is taken up, we cannot say for sure. But right now, at least it is not causing any harm. So that is the first thing in medical treatment. Drug should not cause any harm. Any treatment should not cause harm. So as long as it is not causing any harm, it's a very good drug.